There are a number of different research projects looking at inherited bowel cancers. Some of this research is looking at medicines to try and prevent the cancers associated with these conditions. Some of the research is looking for new genes that can be implicated in genetic causes of bowel cancer. The major study at the moment for patients who have Lynch syndrome is a study called CAP3. There is very good evidence from previous studies that aspirin is good at preventing cancers, all types of cancer, in patients who have Lynch syndrome. This current study is looking at the dose of aspirin that one should use. So patients will either be randomised to 600, 300 or 100 milligrams of aspirin to be taken on a daily basis. Patients are only eligible for CAP3 if they are known to have a fault in one of the mismatch repair genes. If you want more information about this study, contact your local genetics service or look at the CAP3 website, which has a lot of information on how to enter. The other studies look at whether there are other genes that we're currently unaware of that are implicated in genetic forms of bowel cancer. One of these is called CORGI, and this is a study for patients who have a family history of bowel cancer but who are not affected themselves. The 100,000 genome study is looking at patients who have multiple bowel polyps to see whether we can identify any new genes associated with bowel polyps or bowel cancer. This study will also include patients who are diagnosed with bowel cancer at a younger age. If you want further information about those studies, you should again look at their websites or talk to your local genetics service. There are a number of other research projects looking at bowel cancer in general and looking at the genetic background for these. Most of these are found on websites, in particular the Cancer Research UK website is good, and there is a national website which can give you information about any trials that are currently recruiting.